What is your name?
Kim.
And how old are you?
37.
What diagnosis are we discussing with you today?
Alzheimer's.
Who has Alzheimer's?
My grandmother.
Do they have health insurance?
Yes, she does.
Now, for your grandma, when did her first symptoms appear?
Probably late 2016. She started forgetting normal driving routes, like from her house to the grocery store.
So it wasn't that she was forgetting where she was just going, but how to get there.
Right, or she would drive somewhere in the local vicinity, but then she would call somebody and say, this is where I'm at. Like she would go, like if she was going to Lowe's or Walmart, she would end up in the Home Depot parking lot. So it was in the right vicinity, but it just wasn't registering to her where to go.
When she was first diagnosed, what was her living situation?
She lived at home.
By herself?
With my grandpa.
Okay. Mm-hmm. So, what kind of led up to the diagnosis? Did you guys take her? Did she see a doctor?
My mom and my aunt took her to her primary doctor, and they did that generic test. She passed. Mm-hmm. And then maybe a month or two later, they took her to a neurologist for a second opinion, and she passed that test. And then about 2 months later, it was the beginning of 17, they took her to another neurologist, and she was borderline, and that's when they started the diagnosis.
Okay. Was she, during that time period, were her symptoms getting worse, or was it still just the forgetfulness?
It was mainly the forgetfulness.
So when she got a diagnosis, or when you guys got a diagnosis, how did she handle that?
She didn't believe that she had anything wrong with her. She told my mom and my aunt that they were just overreacting. However, in a 6-month period after the original diagnosis, she went, I don't want to say downhill fast, but her mental state changed drastically, to where it wasn't just forgetting. She couldn't drive anymore, but she would get to where she would leave the refrigerator open, or she would leave the stove on. And within that 6 months, she stopped bathing. And still within that 6 months, she was still in denial.
Mm-hmm. And what was the process with your family? Like, was there decisions to be made there? Was she continuing to live with your grandfather?
Yes. So she lived at home for about 1.5 years after her diagnosis, until my grandfather's health started declining and he couldn't take care of her by himself. But they collectively, as a family, there's 4 siblings. They all talked about her care. But then when my grandfather's health started declining, they moved her into
When did she go into the nursing home?
February of 2018.
Okay. So after she got the diagnosis, you said that there were 6 months that things started shifting.
Right.
Is that after the diagnosis?
Yes.
Okay. Mm-hmm. How would you explain it after that? Like, how has it gone after that?
So her ability to recognize people deteriorated very quickly, like less than 1 year after her diagnosis. Like she was still at home, And then I would go like 2 or 3 times a week to bathe her because she stopped realizing that she needed to take a bath. So I would go over and bathe her a few times a week. During that time, and this was still within a year of her diagnosis, during that time she recognized that I was a familiar face, but didn't recognize who I was or that I was related to her. And it was like that with the whole family. We were just good people. And like she knew that she could trust us, but the name recognition and how she knew us was gone.
So you were talking about your grandfather. Let me just first clarify. How old is your grandmother?
83.
So she was
79.
79. Okay. What was the situation with your grandfather? How did he handle it?
He was very upset because she didn't recognize him until she never really re-recognized him, if that makes any sense.
Right.
But she went back to that 20-year-old mindset, 20s, 30s, and they slept in separate rooms and separate beds since I was a kid, where she would go back and try to get back in bed with him in the middle of the night, and him being 84, 85 years old at the time, it was aggravating because he was trying to sleep,
Right.
and she was not trying to sleep. He was heartbroken at first, but then he just knew she had to be cared for. And he also knew that we have a very supportive and involved family, so he had the support to take care of her.
So the decision was made to go into a nursing home.
Mm-hmm.
How difficult was that decision?
It was hard because we are a very close family and we are very involved. We didn't want to feel like we were just putting her somewhere, but she got to a point where she needed 24-hour care. She needed someone to have eyes on her 24 hours, and my grandpa couldn't do it. We were, the family had their own lives and families to attend to. It was more heartbreaking than anything, but we knew it had to be done.
Did you ever feel like you were judged for putting her in a nursing home?
No, and I don't think anybody in my family did either. My aunts and uncles, I don't think they felt judged, only because we know how involved we are. Mm-hmm. And there was never a day, even when she was in a nursing home, there was really never a day that she didn't have one of us go visit her at some point in the day.
So you said when she was in a nursing home. Where is she now?
She is home with me.
When did that happen?
March of this year.
Why did that happen?
Not because of COVID. Okay. So it was a decision that we made late January, early February as a family. I was still in nursing school, and she took a fall in January at the nursing home. They kind of walked into her room, and nobody knew how she felt, that she was just on the ground. She went to the hospital, stayed in the hospital for 8 days, and it just brought a lot of concern to her children, and I just said, take her home and let me take care of her. So that's what we did. We started that process, and we actually got her out a week before everything started shutting down because of COVID. It was just timing.
Who handles, in your family, who handles her finances?
My aunt, the youngest sibling.
And does she have a living will?
No, she's got a power of attorney.
Mm-hmm. And is that your aunt as well?
Yes.
Okay.
Mm-hmm. And she's got guardianship over her through the courts.
So, what does your day-to-day life consist of when you're taking care of her?
So she sleeps a lot. She goes to bed about 8:30 at night and gets up at 11 o'clock in the morning. She gets up, she goes to the bathroom, cleaned up, does her bathroom business, and then we go to the table for lunch. She eats. We try to have an activity with her, but she's reached a point where she's just not interested in it. And when I say activity, I'm talking a 24-piece child puzzle or one of those baby toy stackers. She'll stack those sometimes. If she doesn't seem interested, or if she completes it and, looks at it for a minute, then she sits on the couch and then she naps for another hour and a half or so. We try to keep the TV on, I guess more background noise than, because she doesn't really pay attention. She will watch cartoons, and then she eats dinner about 6 o'clock, and then by 8 o'clock we're toileting and back to bed.
Does she ever get frustrated?
Changing her clothes. She's, or trying to clean her bottom after she goes to the bathroom. She doesn't want, it's more of that conservative, don't touch me there, that's my private area, I don't want to be naked in front of you.
Modesty.
So that's the only time you really get any resistance from her. And she'll tell you, she may say, I don't like that. But other than that.
So it could not just be modesty, but also from just safety-wise, the mechanism of, I know that people should not be touching me.
Right, yeah.
Okay. So how do you feel with all of this?
I feel like she deserves better care than what she was receiving. That's why I did it. But it is very taxing on the body, lifting her up, picking her up. She doesn't move unless you move her. I tell people all the time, the way that I put her in bed at night is the exact same way that I find her in the morning, unless I move her. And she's a back sleeper, so I have to move her because she's incontinent. So I can't let her sit in urine all night long. It's just like having a newborn baby. You got to change them every 2 hours. It's tiring. It's stressful. You're always worried about a fall. She bruises easy, not because she's on or not because she's on blood thinners, but she just bruises really easy, and so she gets skin tears really bad when trying to move her or undress her or bathe her. It's stressful.
So do you ever feel angry?
No, I don't feel angry. I feel angry at the disease.
Right.
When this all started, one thing I used to say was that it's harder to mourn a living person than it is to mourn somebody who is no longer here. I feel like we're going to have to mourn her 2 times, her mind and her body. So I'm not angry at the situation, but I'm angry at the disease.
So, kind of touching on that sleep thing, do you feel that you sleep well?
I sleep okay. Could I use more sleep? Of course. But I do, I don't have a problem sleeping. It's just more so I have an alarm set for every 3 hours. I get up, I make sure she's okay, I turn her. And I mean, other than that, I mean, it's a 15-minute thing unless she's, had a bowel movement, then, it takes a little bit longer, especially when you're by yourself.
Mm-hmm. So is it just you in the house, or do you have children or family?
I have my 8-year-old daughter and my 18-year-old daughter there with me.
Do they help assist at all?
Yes. My 8-year-old is more so for entertainment. She keeps Grandma giggling, and Grandma will just watch her in the house. She dances, so she'll just watch her dance in the living room. So she's more so for entertainment, and she enjoys being the helpful one, even if it's just holding her hand to walk to the bathroom. My 18-year-old, she'll help bathe if it's a bath day and we don't have a sitter coming in or a paid help to come in.
So how often and when was that decision made to have help come in?
When we moved her home.
Okay.
Yeah.
And so did you find it, without getting into real numbers, did you find that it was price-wise for a paid sitter versus a nursing home?
It is more expensive to have her at home.
Okay, so the sitter and everything.
Yeah, because we have a caregiver, a medical assistant through a company, and then she comes 4 days a week. But then we also have it's a family friend of a friend kind of thing that's more of a private sitter that comes when I need help or a break or have something to do when the company people aren't there. And then we just recently moved her into hospice. So there's an aide that comes in to help bathe now.
So with hospice, that means you're looking at how much time?
They haven't really said. The nurse that initially did the hospice assessment, she says 6 months to a year. But we've heard 6 months to a year for about a year. We've said for a long time, she's healthy. Her heart's healthy. Her kidneys are pretty healthy, other than just the aging process, other than her mind. And, but in the last 2 months, we've seen a significant change health-wise. Fluctuations in blood pressure. It's up one day, it's down the next. The incontinence has changed drastically. She used to, even though she can't tell you I need to go to the bathroom, we still toilet her every 2 hours. Or if she's drinking more because she's got low blood pressure and we're giving her more to drink, we take her a little more often. But she has started pooping in her depend instead of waiting till she gets to the bathroom. So there's some changes that make us question how much time do we really have.
When she's eating, does she eat it well, or?
Yeah, she eats really well. That's another thing, is her weight has dropped, but it's not because of the lack of food. She eats very well. She eats 2 meals a day, but she's very slow. It usually takes about an hour to an hour and a half for her to finish a plate of food. And her plates of food look like what you would fix your 5-year-old. Very soft diet, but she's got a meat and maybe 2 vegetables, or a vegetable and a fruit or something. But she's very slow.
So as I understand, your grandfather passed away.
Mm-hmm.
How did she handle that news?
She did not know. She was there. She was in the nursing home at the time. So even if we would have told her, he passed away, it didn't register with her that was her husband. At the funeral home, for the visitation, she did stay by the casket, but she never recognized that was her husband in the casket. There was one time at the funeral itself, at the actual funeral, that she told somebody, "That's my husband," and then, but 5 minutes later, she didn't know why she was at the church.
So, how has this diagnosis affected the path of your life?
I've made a commitment to stay with her until it's her time. My family is pushing me to continue on with my life, just be there, for her when I'm not working. We have the means and we have the help, so I can go to work. But with COVID, I made a decision not to work for a while because I didn't want to risk bringing it home to her. There was just not enough information on COVID in the very beginning. So I made a decision to not go to work and just stay with her, because she couldn't tell us if she didn't feel good. And the only thing I had to go off of was to take her temperature every day, because we had, sitters and people coming in and out. So, that's all I had. She can't tell me that she doesn't feel good.
Right. How would you say that this has affected your mental health? Your inner peace of mind, mental health?
It feels good to me. It makes me feel like I'm doing her good. I know she's at home. I know she's happy. When she was in the nursing home, anytime we went to visit her, she always had her purse and she was ready to go. She didn't want to be there anymore. She knew that wasn't home, and she was ready to go. When can we go? When can I go? When can I get out? But being at home, we've seen a big difference in her demeanor. She's happier. She doesn't get as upset anymore. Baths are a lot easier, whereas the nursing home told us that, she wouldn't get in the bath today. So my mental health, I don't think that it's affected me in a negative way.
So, if you could choose one emotional descriptor for yourself regarding Alzheimer's and how it has impacted your life, what would that word be and why?
I would probably have to say, stressful. There's a lot to worry about. There's a lot to pay attention to, because they can't tell you things. And that's just from being at home with her the last 5 months. It's a big, huge responsibility. And I know some people think, it's just like taking care of a baby. And I said it, earlier, it's like taking care of a baby. She's, in a diaper. It is so much more than that, because it's an adult baby, and you have so much more to think about, and deal with. And, it's stressful.
So, is there anything that you would tell budding nursing students or nurses, new nurses? Is there anything that you've noticed over the span of these years that you don't think that people really understand or really get about Alzheimer's and taking care, or family, or something like that?
So even though it's my grandmother, I still have to look outside the box sometimes. And I see it with my aunt and my mom. That's their mom, and they're still in the mentality that it's going to get better. It never gets better. It only gets worse. And you have to have, when you're dealing with family, you have to have the compassion and the understanding, to help them through it. You have to help them and talk them through the process, and help them understand that she's not going to talk to you anymore. She'll smile at you, but she's not going to talk to you anymore. One thing that my aunt is still stuck on is medication. She wants to wean off certain medications, and we tried that, and it changes their demeanor all the way around. And you can't do that with Alzheimer's patients. You can't, you can't think that it's going to get better. Patience. You gotta have patience. Gotta have the compassion.